come from the Chinese thinking. For you, probably say, what? When you cannot really understand it very well, you don't want to read it. But the essence this book actually has clear idea. Go back to look at the differentiation according to 8 principles. You will see it said the exterior syndrome, it is a location. If it's exterior location, like related to tendons, sinews, divergent channel, and also skin, the surface of the body, that has the exterior component. If it is organ, it's interior. Then the other things you already talked about. If there's chills, fevers, sensation combined together, and the pulse is a thing, and sorry, not a thing, it's a superficial, and the tongue coating is a thin white, then it is exterior. So please remember this. Why I talk about this? If a Jin River point deal with the exterior branch of the meridian, it can deal with what?
Exterior syndromes.
The exterior syndromes. Remember the classic understanding of the Jin River point we talked about? It said in the classic book, Nanjing, this book. You can look at your handout from quarter 1. It said in this book, Nanjing say, 景祖喘克寒热. Jin River point treats cough asthma due to cold and heat. Remember that discussion? We had a little bit of discussion about that. And so that tells us it can deal with lung issues because you look at Jin River point on the yin meridians, it is related to the what element? On the yin meridians? Metal. So it's lung. And then because it deals with exterior branches of that, it can deal with some exterior things. Why I talk about that? Look at this function. If I don't put it here, often we will not think about bladder 60, deal with wind, right? Yes? But if I review this, tell you, okay, this is Jin River point, possibly deal with exterior, then does it make sense this point can expel wind? What kind of conditions that we will use this point? Often for someone catch a cold, will you use this point? No, not really. This is not the first line of points we think about. What will be the first line of points you think about when someone catch a cold? You may think about do 14, very good. What else?
LI4.
LI4, very good. GB.
20.
GB20, very good. Gallbladder 20, those kind of points, wind and exterior, right? And LI4, another point on the arm.
Lung 7.
You can use lung 7, but even better than lung 7.
5.
Sanjiao 5, very good. Why Sanjiao 5? Do you still remember? Because it is
The master sign of a Yang Wei mind.
master of Yang Wei. Yang Wei deal with what?
Fever and chills.
Fever, chills, body, exterior part, right? Okay, so we often think about this. When will we think about to choose the bladder 60 for when there is wind? What kind of presentations the patient has to make you think, oh, bladder 60 will be good?
Pain along the channel that comes and goes.
Pain along the channel comes and goes, very good. What else? What will be, yes? I see you see something. No?
No, I'm not sure, actually.
Okay,
Could be internal wind?
not that much for internal wind, no. When you have a cold, especially wind cold, what symptoms often you may have? This point will be good.
Headache.
Headache, pain at where? Occipital area. You learn the syndrome like here has tightness, yes, cold, headache, and even like Ma Huangtang talk about that kind of presentation. The wind cold invasion, yes? Okay, great. That will be good, yes? It can expel wind and also it is on the what? Bladder 20, I mean, Taiyang meridian on the line. the Taiyang meridian, the bladder. Okay, great. Another thing we use is more local. Earlier I mentioned most of B syndrome started from exterior syndrome or interior syndrome?
Exterior.
Exterior. That's why we said B syndrome is caused by wind, cold, damp combined together, invading the channels, cause obstruction. And so if someone has ankle pain, has B syndrome, will this be a good point? Yes, this will be a good point. So we look at the function of the point, look at which area it associates with the meridian, where the meridian goes. Think about, okay, applying the function to certain indications. As I said, patient will present to you the symptoms, signs. They will tell you, I have wind cold syndrome, I have wind heat syndrome. They tell you, I have this, I have a pain, then you translate that into syndrome idea. And then combined with the location, everything, this is how we choose points in the clinic. And this point can promote the circulation in the external branch of the meridians, so it can invade blood, can remove obstructions from the channels, can relax the sinews, especially relax the sinews locally. And that will help the external branch of the meridian. And then as what point it can clear heat? Fire point. What kind of technique you will use if you want to clear heat? Reducing technique. So this talk about combined with the technique, doing reducing technique at this 5 point to reduce the heat. Okay. This lead me want to talk about this point to treat urinary tract infection a little bit more, UTI. Talk about UTI. Most cases has what kind of syndrome? Damp heat. This point, does it deal with the heat? Does it deal with both damp heat? Deal with
Damp heat, because it's the bladder that eliminates water, and it's the fire point, so it deals with severe heat, so both.
very good. So deal with both damp heat because it is on bladder meridian. Bladder meridian, all the points can promote urination, especially the distal ones. Talk about the points below the knee, below the elbows, those are the distal points. Every meridian has a system, an area to deal with, mainly focus, right? That will be the kind of major indications of the meridian. So bladder meridian, of course, will promote, the distal points on bladder meridian will promote urination, so it can help get rid of dampness. Then this is a 5 point by using reducing technique can help clear heat, so it can help both damp heat. And even better, last week we talked about why it strengthens the back a little bit, because it, what's the reason? Anyone remember?
It stimulates kidney 3 too.
Very good. It will stimulate kidney 3 there also, and it will help, tonifying kidney qi passively a little bit, strengthen back. That's why it treats chronic back pain. And chronic back pain often has both, excess and deficiency, like you said. This point, more deal with excess or more deal with deficiency?
Excess.
More excess. It is, help tonifying kidney qi a little bit, but at this point, more deal with excess. It can help both. That's why I say even better for UTIs, if you can get rid of damp heat and also boost the kidney a little bit, won't it be good?
Yeah.
It will be good. And in China, there is a mountain called Kunlun Mountain. And when we say someone, especially like a man, like someone is like upright, strong, can carry large, can hold a large, we say this person is like Kunlun Mountain, right? It's like a very, the mountain, it's at a range. And so the name of this point is called Kunlun. If you needle this point, as I said, it can help promote chin blood flow in the entire bladder meridian. It's the meridian support the back, upright the person. And also this point can tonify kidney qi a little bit. It give internal that qi a little bit also. So it's kind of like, has that image. You do the point, at there. Because a mountain in Chinese culture, understand like this, it's a rise from the earth, and feet is contact the earth. So you do a point like close to the earth, the ankle area, make the whole person kind of stand up straight, strong, and has that image. If someone has a lower back pain at the sciatica area, will they able to do this? No, they won't able to, and so this one leaving the pain. Sometimes people ask me, say, for sciatica pain, we can use gallbladder 34 as a distal point, we can use bladder 40 as a distal point, we can use bladder 59 as a distal point, or 58, or 60, or 62. How will you decide which one to choose? Later we will do comparison of the points. And I have a general sum of rule idea. I usually choose a distal point beyond the pain. Say, if someone has a sciatica, either due to like pinch on the things at the back area or at the the muscle area, if it's just radiating down to the side, on the side or back, I probably will choose the distal point more at the knee level. If it's radiating down below the knee, then I will choose a point around the ankle area. And have you heard the saying about open the chain of locks? The idea, especially when we treat a stroke patient. I was involved in research for stroke patient for half a year in China, in hospital, in inpatient department, inpatient wards. And we often use like LI15, LI11, LI4, and maybe LI5, That's the idea of open the locks. It's like on the meridian, like at the joint, it's like the lock. If you cannot use the point at the joint area, it can help the flow better. So that's why, distal point wise, we do that way. I do that way for sciatica pain. And so this one can be distal one and radiating down below the knee. Great. So last week we talked about bladder 59. Bladder 59. Why I want to bring up bladder 59?
Because it's the she cleft of the young child
Very
line.
good. Why?
And bladder 62 is the master.
This is master of young child. So both can address young child meridian. Yes, both can address young child meridian. When do we choose a point on the young child meridian? When we'll just choose a point on the bladder meridian?
When there's like lateral, when there's weakness in the muscles on the lateral side or inversion.
Very good. So maybe the muscular system along the lateral side is involved, weakness or the cause foot eversion change. Very good. What else?
When it's affecting mobility.
It's affecting mobility more, young child related to mobility. How about areas? Which one cover bigger area, young child meridian or bladder meridian? Young child meridian. Young child meridian related to what part of the body? The back, the side, and little bit front, like stomach meridian area. So basically, young child meridian covers the young area of the musculoskeletal system. It's kind of like a connect that. And in child, it is the medial aspect of the muscles, like the in part of the limbs and also the front will be like more in child area. So young child meridian actually cover a little bit bigger area, not just the bladder meridian area. And as a master point of young child meridian, it of course can open the young child meridian, and it can strengthen the muscles, because child meridian is really dominant the musculoskeletal system for mobility or that. It can relax sinews, it can remove obstructions, and can use for chronic back pain, leg pain with weakness, because it can remove stagnation. It also can strengthen the muscles, and it also can use for weight syndrome. Weight syndrome often has muscle weakness combined with pain, with maybe like dysfunction. Sometimes the severe weight syndrome, if it's only weight syndrome, has no pain, just the muscle weakness, and we need still help with circulation. Blood circulation give muscles TLC, tender love and care. And so it will help with the circulation in the muscular system, try to strengthen the muscular system. Even when there is no pain, we still need help with the circulation. And the sequelae of wind stroke often has the combination of muscle weakness, stiffness, and the pain. It's muscle has an issue. And then insomnia. Why insomnia? Related to eye, very good. Then we talked about the foot inversion, eversion. We discussed that. You can review, right? Yes. Okay, great. And then you can read bladder 67. So the position of the fetus for that. So okay, now let's do homework. Did you do that homework? Yes. Exercise 1. Between bladder 28 and 32, which one is better for urinary disorder? Which one is better for menstruation disorder?
28 is urinary.
Very good. Bladder 28 more for urinary, and 32 more for
Menstruation.
menstruation. Very good. If I ask you, say a true or false, if I say bladder 28 only used for urinary disorder, is that a true or false?
False.
It's false. Same thing, if I say bladder 62 only used for reproductive disorder or menstruation disorder, it's true or false?
False.
False. Both can do the same thing, right? They're so close we talk about. That's why I had you look at the research article. And bladder 28 was chosen to actually move blood in the uterus for that. And I'm treating a lady now twice a week. I treat her once a week. I have my clinic associates treat her once a week on Saturday. And she had a Doppler showed that the blood flow to the uterus is really not good. And she will have IVF end of this month. So we wanted to use acupuncture. She was referred to us by the doctor. And we are treating her yesterday. I saw her, and I encouraged her request for another Doppler, just to see how her flow of the blood to the uterus is like. Okay, now next question. Bladder 40, 57, 58, bladder 40, 59, 60, 62, all treats low back pain. How do you differentiate them? Let's put them on the board. Who would like to talk about it?
So, okay, so bladder 40 is ruler of the back, so it seems like it would be used for most anything except this said specifically that it was severe lumbar pain and it moved up the back with stiffness of the sinews.
So you say for severe lumbar pain, you will not use it?
No, I would.
You would, okay. And so for all kinds of back pain?
For all kinds, but specifically if somebody came in with like an acute, severe condition with stiffness all the way up their back, I would go to bladder 40.
Okay.
And I might do other ones too, but that would be something that would say to me, definitely you need to use that one.
Okay. And you want to continue? Because for comparison, you did talk about.
Oh, I need to compare all of them at the same
Yeah.
time? Oh. Okay, so we're going, so for bladder 57, I had sciatica with pain that radiates to the calf
Okay.
more.
Uh-huh.
Is this how you're even asking us to compare them?
Yeah, I
Am
will
I
just hear from you, then I
Okay.
will, do a summary. So I
Okay.
want you think about it, we already talked about it, I have you, read, and then I will do a summary, then I will maybe ask you some other questions related to this points,
Okay,
yes.
so bladder 58, so bladder 57 was sciatica with pain that goes into the calf, and bladder 58, I kind of distinguish that as pain that's running more down the lateral side of the leg where it was kind of between the gallbladder and the bladder channels. So where 58 comes across, you might think of that. 57 had more night cramps, 58 was more leg weakness. 59 was all of the things we just talked about the young child because of the lateral leg weakness and foot problems and regions of that covered. So we just really kind of covered 60 and 62. So the Jin River again, I had contraction anywhere along the channel, cramping in the lumbar region, hurts to walk, can't take a step. And 62 was, I had for chronic pain and all of the symptoms of the young child, pain in the back, lumbar region, lateral leg, foot inversion. So to me, the ones that were on the yang chow or activated the yang chow covered a bigger area than the ones that specifically just had, I have pain here, but it's also right down the side of my leg, or also just goes right to my calf.
Okay, great, thank you so much. She did a good comparison. One thing she said is not very accurate. I'm wondering if anyone caught it. So you did a good comparison regarding the locations of those things we talked about, and one thing. Yes.
Was it just the bladder 58 thing, just like treat, like she was thinking, I think she said treated it along the channel, like specific to the channel, but is it more because of it's the lower point, so it's kind of displacing energy to the kidney and helping strengthen the kidney to help with that?
That is right, and but location-wise, what she said is accurate. So you added additional information like how it can help the weakness. It's not at that point. Another point. Yes.
Bladder 40 can treat a chronic and acute because the other name is the blood she cleft, so you can bleed bladder 40 for acute symptoms.
Okay, great. Yeah. So that she touched on that. She said for the acute ones she will treat, but you are right. Bladder 40 actually can treat both the chronic and acute. Yeah. And can treat both. It's the ruler, but she didn't touch on the acute one. It's not at that point either.
Okay.
Yes.
She said that bladder 57 treats sciatica, which I didn't think it did, but
Can it treat sciatica?
she said it can. It can?
Yes.
Okay.
Yeah, it can. On the meridian, it can. It's not at that point either. So we narrowed down. We eliminated the 3 already. Have 3 left. Okay.
Was
Yes.
it just 60 again, just saying that it strengthens the back of your kidney 30?
No, it's not that. So we got to find just the 2 left.
Was it about bladder 59?
Yes.
Okay.
What is she said? She maybe actually on her notes may have it, but she didn't distinguish that one very clearly. What did she say?
I can't exactly remember what she said, but I'm not sure if she said that it frees pain and stiffness of calf, ankle, and foot. Did she say that?
She
I
didn't.
didn't
That,
say that for that.
yeah, that is right, but that is not the thing
Okay.
I want to clarify.
Low back pain, affect mobility.
Yeah, the location, she touched on that. She didn't specifically mention that, but I think based on, what she said about the Yangchao meridian, I assume she understands that. One thing she didn't really pull out from her comparison is something.
Did she say it was acute?
No, she didn't touch on acute. Very good. You are on the ballpark. What she said?
Oh, because it's the chief left point.
She actually said that it's used for weakness, for, the things she mentioned make me interpret that this one is for acute or for chronic, for deficiency or excess.
Deficiency.
Oh, deficiency.
The way she said the young child can help with muscle weakness, she made like general statement about the young child meridian, but didn't indicate that this point is actually what kind of category?
She clapped.
She clapped. It is actually more used for access and acute type of pain. That's the thing. She kind of like touched on general young child thing we talked
That's
about.
exact, I did, because even when I was going through them, I was thinking, I know there's something I should be isolating because this is the chi cleft point, and I just didn't grasp it. It was just, I knew that there was something, but I didn't.
Okay, great. Thank you. Thanks. So for the point of comparison part, I want you to listen to what your classmates say, and then have a discussion. This will help everyone do a review. And so the major difference, I didn't purposely do review of 59 and 62 because we have this list. I want to hear if you got it. So both 59 and 62 used for young child. 59 more used for access, acute type of pain related to the young child meridian area, while 62 can use for chronic ones. As master point, it has a little bit more kind of strengthening function. So that's the major difference. Okay, wait, then I have a couple of questions to ask you. One thing, 59 58 could take a little bit more clarification. Someone like Glenda touched on, it is a low point, tonifying kidney also. Let's go back to say it treats the lower back pain. What kind of lower back pain make you think, okay, 58? Because I want to also touch on the deficiency part a little bit. What kind of presentation make you say I choose 58?
Kidney deficiency.
Someone has lower back soreness, and soreness is not necessarily deficiency. What will tell us there is deficient in nature?
Chronic.
You palpate, you can release.
Chronic and put pressure on it to give it support, pressure, and it will give it release, more support. Because a lot of times people say, okay, rub on it will release it. Even for excess pain, have you had the experience you rub on it also feel good? Massage feel good, the body work feel good, right? So it does not really stand out, not like the stomach pain, If it's deficiency, you put pressure on it, it's good. If it's excess, you put pressure on it, it's not good. For muscle problem, even this excess, you rub on it, feels good. So often when there's a deficiency, patient tell you, like my back feel kind of like need chi to support it, and I wear body support or use my hand to support it, feels good. Feel kind of like a lack of support, that kind of feeling. Another thing people will feel, the lower back pains get worse when they feel what?
Cold.
If it's deficient, not just the cold, because excess type of lower back pain, cold also will make it worse. If it has a little bit of chi deficiency, what will make lower back pain aggravate? Fatigue, feel tired, like running around for the whole day, at the end of the day, feel tired, then lower back pain feel worse. And also even the timing when the lower back pain feel worse, usually after 7 p.m., after 5 p.m., like they feel, the whole day is down, I'm tired, and the lower back pain. So it has that kind of presentation. And, when they tired, overworked, worse, and need support, feel kind of like not enough chi, that kind of feeling. And if you ever had that kind of experience, you understand almost like you need a chi to support it. I have that. Every time when my lower back pain has, lower back pain got worse, my chiropractors always say, you need to do less, you need to do less. I watch myself, true. When I have a busy week, then I suffer lower back pain a little bit. Okay, good. And if someone has, like a lower back pain, muscle cramping, also abdominal cramping, and maybe looser stools or abdominal bowel movement. Among these points, which one will be good? Which one?
57.
40. Why 40?
The earth point.
It's the earth point. It's the earth point. It is a ruler of the back, of course, deal with back. And if you go back to look at the handout, it also deal with the digestive system, right? Abdominal pain, cramping, and that. So as well. Okay, good, good. And the 57, we talked about it already, the muscles and the 60. Okay, great, good comparison. Any questions regarding this? Yes.
Last week you had said with bladder 40 that it could treat pain due to blood stagnation, and you didn't mention that today.
Okay, yes, definitely. She mentioned like acute pain, like if there's acute pain will be good. Someone else said, you or someone else said, especially acute pain can do bleeding. Yes, definitely for blood stagnation too will be good, especially doing the bleeding method. And for that kind of pain, like people have acute, like sprained the lumbar area, muscle is tight and has stagnation. Very good. Any other additional things? I didn't talk about every possible things that the point can do. That you have to read the slides. Here I'm just do a general comparison, like they can treat lower back pain. How will you choose them? How will you differentiate them?
So can you explain the bladder 57? What kind of?
Well, actually, I'm just thinking about one more thing, bladder 57. Let me ask you a question. Have you heard sometimes people have lower back pain? It's really due to a sports injury when they are young and like ski and jump and hit the tailbone area. And sometimes chiropractors will adjust the tailbone. If you not adjust the tailbone, pull the tailbone out, you know, when the tailbone get injured and can protrude anteriorly, and it will cause the whole curve line change at the lower back. And so if you not correct that tailbone, the lower back pain won't get better. Have you heard of this kind of thing? Yes. So for lower back pain, due to that reason, which point will be good among this point?
57.
57 will be good. Why is 57 will be good?
Because of the bladder divergent sinew channels?
Very good. Bladder divergent sinew channels we talked about, right? We said this point is good for hemorrhoids, remember? I asked you why good for hemorrhoids, the relationship was there. And so this one, like she touched on, if it's, you know, like radiated down to the calf area with the calf muscle spasm will be good. That's true because it's local. If we're radiating down there, you can address it. And if we're radiating down there, when there is pain, often has chain blood stagnation. If muscle does not get enough chain blood supplies, it will have cramping. It will have cramping. It's true, muscle really needs TLC from blood. And so that is one thing she touched on. Another thing I just added, if the pain is along kind of like the dual meridian, start from the tailbone area, bladder 57 will be good. It's kind of like a dual meridian, bladder meridian, both involved, but it's due to the line issue. The whole back, you know, the spine, the curvature is very important. When the curvature is abnormal, it can cause pain. It's a start from the midline to the side. It's kind of dual meridian to the bladder meridian. Shall we take a 10 minutes break, then come back, talk about the other reading? Okay, great, 10 minutes break. We'll come back, start with CV reading.
Yes.
I put your name on the sign-in sheet for last week and this week.
Oh, pretty good.